So having talked about this, it is also important to talk about one of the predisposing factors for diabetes mellitus. And well, the first thing I would like to mention amongst the predisposing factors for diabetes mellitus is number one, the presence of insulin antagonists. Just like I've talked about, when insulin is being produced, and then there are specific cells that are resisting insulin to bring about the physiological changes in the body, or inside the cell rather, because it is the arrival of insulin and the combination of insulin and the insulin receptor cells at each typical site in a cell that will bring about the physiological change in the cell, and then it will take that glucose inside the cell so that the mitochondria can use the glucose. But in instances where we have got the insulin antagonists, for example, if we have an hormone adrenaline, that could be an insulin antagonist, and that will stick, instead of the insulin sticking on the insulin receptor cells for it to bring about the physiological changes, hence the insulin antagonist, the adrenaline will stick to those receptors, and then the insulin will be prevented from combining in together with the insulin receptors, and that will bring about the increase in high sugar levels in the blood, because the sugar levels, the glucose can't get inside the cell, hence it is just remaining outside, it's being antagonized, it's being acted against, it's being resisted, so that will bring about glucose. The other thing I will talk about on one of the predisposing factors for diabetes is liver disease, or liver cirrhosis, or liver cancer. Why am I saying this? Well, the pancreas is an endocrine gland which has got it's both an endocrine gland and exocrine gland. So the endocrine gland, or the pancreas, is the one which has got the pancreatic islets, and the pancreatic islets are the ones which are going to produce insulin and glucagon. It is these two hormones that are responsible in the maintenance of blood sugar regulation in the body. So in cases where we have liver disease, so the pancreas can produce insulin, insulin is going to go in the blood, and then it's going to get some of the insulin, some of the glucose rather, sorry, it's going to take it inside the cell, and some of it is going to package it in the liver. The insulin will do two specific functions. One, it will bring glucose inside the cell. Two, it will package the glucose in form of glycogen and store it in the liver, where it can be used up when you are hungry, or maybe you've not eaten for quite some time. But in this case where we have this issue of liver cancer or liver disease, or hepatitis, for example, where all the liver sinusoids and all the liver cells are damaged, so we won't have anywhere to store our glycogen, the same glucose which is stored in form of glycogen in the liver. We won't have anywhere to store it. So instead of taking it in the liver, it will just remain in the blood, and that will predispose us to diabetes mellitus, because the sugar is always going to remain in the blood. So that is one of the predisposing factors. The third predisposing factor I'd like to talk about is obesity. Well, we probably know that obesity can predispose someone to type 2 diabetes, and this is true. The reason being is that there is always going to be an increased demand for insulin production because of the increased amount of the adipose tissue. The body is growing big, and then the pancreas is just too small. Then that same pancreas, which is small for the body, is the one which is required to produce insulin in order to lower blood sugar levels. So the pancreas can't get enough for insulin because the body is too big for it. Hence, someone will be predisposed to diabetes mellitus. There are other quite several factors. One of the most important factors I would like to talk about in this case, that's number 4. It's genetics, of course, genetics. And this one, genetics is a non-modifiable risk factor. This one we can't change it. So if someone comes from the family or the background where the parents were obese or they were diabetic, then someone is likely to become obese, to become diabetic mellitus. They can carry it in their genes. So those are some of the predisposing factors. Others would be lack of exercise, physical inactivity. We mentioned a few. So what we want to do now